Do you have red, itchy, irritated eyes? The problem may not be your eyes, but rather your eyelids. In this episode of OCuTALK, Dr. Mila Ioussifova will be talking about an eyelid condition called blepharitis that inflames the eyelids and can lead to dry eye conditions. Dr. Ioussifova?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Everyone, please welcome Dr. Mila Ioussifova. Dr. Ioussifova, thank you so much for joining us today.
Thanks for having me.
Well, it's a pleasure to have you here, Doctor. We know you're very busy, so we appreciate you coming on the show with us. Before we get going, though, I was hoping that maybe you can introduce yourself to our audience. Just let them know a little bit about your background and your specialty.
Sure. I am a practicing optometrist, and I practice in Portland, Oregon. I've been practicing for about almost 17 years, hard to believe. And I have a private practice in Portland that it was a cold start practice that I started 10 years ago. We actually just celebrated our 10-year anniversary, so that was exciting. We made it. But pretty much early on in my practice, I was really dedicated and really passionate about treating patients with dry eye disease. So that's really my specialty. At this point, I only see patients with ocular surface disease, with dry eye disease, and we offer, and pretty much from day one, we've been offering advanced treatments, and we just keep adding to our arsenal of treatments, because we'll talk about it in a little bit about how dry eye is multifactorial, and so there's so many different causes. So really over the years, I've learned that there's no magic one treatment. So you really have to learn about the root cause of each particular condition, dry eye, and really, learn to treat it at that level. So anyway, that's all I do. Really more advanced dry eye treatments, and I love it because I feel like I really make a difference in patients' lives.
Well, that was a fantastic introduction, and congratulations on 10 years there. So you talked about it a little bit in your introduction. You deal a lot with, dry eye and the ocular surface. For our discussion today, we were going to talk to you a little bit about blepharitis. So before we get going, what is blepharitis?
Well, blepharitis is a general term. It's the inflammation of the eyelid, and there are different causes. And again, one of the things that I've learned over the years treating dry eye patients and blepharitis is that everybody has a different type of dry eye or different causes of dry eye, and that could be also true for their blepharitis. So there are different reasons, whether it's bacterial overgrowth or even mites. So it's a general term we use for inflammation of the lids, whether it's anterior blepharitis when you see build up bacteria on the lids, or posterior where with MGD, meibomian gland dysfunction is involved. But really it's kind of an umbrella term. It's usually, if you have patients, studies have shown that blepharitis is a very, very common condition, especially in the older population, that's again associated with that under that ocular surface disease classification. So it's common. If you don't have patients, if you don't look for it, sometimes you can miss it. If you don't actually have, when you have a patient in your slit lamp, if you don't have them look down and really look at the base of the lashes, sometimes blepharitis can be easily missed because patients may not be symptomatic yet.
Fantastic information. And you actually just touched on it in your answer, and I just wanted to maybe expand on it a little bit. You said there are many causes of blepharitis. So what many causes are there? What causes blepharitis?
Well, first of all, we have a normal, we have a microbiome on our skin, right? So that's part of the normal flora. We have some bacteria that are just part of us. We have bugs in our gut, we have bugs in our mouth, we have bugs on our skin and on our eyes. Unfortunately, that's the truth. So we are full of bugs. But when the balance, or that when we have a dysbiosis, which is a term that's used a lot in gut dysbiosis, when you have an imbalance of the gut microbes, but that can actually happen on the skin, which is what we see in rosacea patients. We see imbalance of the skin microbes, and that is why we see higher prevalence of blepharitis, specifically like Demodex, which are mites. So we can think of it as like, okay, overgrowth or overpopulation of different types of microbes. Again, you can have like staph, is a common one. You'll see Staph aureus, and then also on the other hand, very common one is Demodex, which are mites. So again, these are there are two different types, Demodex brevis and Demodex follicularum. So both can be associated with blepharitis with ocular findings, but a lot of times we see the follicularum. And patients get really freaked out when I tell them they have mites on their lashes. One of my favorite things to do, that's really maybe it's a little bit mean, because I pull an eyelash out and put it under microscope, and patients actually see their Demodex, which really has improved compliance with my treatments, because patients freak out. Even if I tell them we all have this, they don't hear that. As soon as they see little bugs, crawling around and dancing on off the lash that I pulled off their eye, they just say, I'll do whatever you say to get rid of these. So that's really, kind of, you can have different kinds, but ultimately what the traditional treatments have been to really address the ocular hygiene and kind of use certain treatments to clean the lids properly in the morning, at night. But my area of interest is really the correlation that we have with the ocular microbiome and gut microbiome. So I really actually sometimes go a lot deeper than just treating it on the surface. I talk to patients about what is going on. Do they have gut dysbiosis? Because those patients that have chronic blepharitis that's really not responding to treatment, there's something else going on the bigger scale. It's not just on the eyelids, right? And that's where I get really excited to talk to patients about like overall health and nutrition and wellness and things like that.
Well, that is pretty amazing, because I think I would do the same thing. I'm more of a visual person, so if you took my eyelash out and I saw something dancing on it, I'd probably be like, "Hey, yeah, we gotta take care of it, right?"
Yeah.
But you talked about it just a little bit in your answer there too. That we all have these mites, whether they're internal or external on our skin. So how common is this? How common is like blepharitis and all this stuff from all the patients that you see?
Extremely common. There was a study that showed basically patients that have dry eye, more than 50%, I can't remember the exact statistic, 50 to 60% will have some sort of blepharitis. And especially patients that are older generation, and if they have either glaucoma patients, they have other conditions, ocular conditions, they're more likely to have ocular surface disease, dry eye. But blepharitis is the prevalence of blepharitis is even higher, probably over 60%. So it is something we should be looking for. Any patient who is concerned or comes with questions or complaints of dry, irritated eyes, we should be looking for blepharitis, because it is so commonly associated. When it comes to collarettes, that, if you see these cylindrical deposits on the lashes, those are collarettes. That is 100% Demodex. So if you see that type of presentation of blepharitis, then you should definitely be treating it as Demodex without even having to pull an eyelash and look at the microscope. You should already know that this is definitely Demodex.
Well, again, fantastic information. And you actually just talked about it. You see dry eye, you see like patients coming in with irritated eyes, and then cylindrical bases cylindrical at the base of the lashes. What other like symptoms should patients be on the lookout for to know, like, hey, I need to go see my doctor about this right away?
So one of the signs of blepharitis, or symptoms, I should say, is when patients wake up and they already feel irritation in their eyes. I ask my patients, walk me through your day. How do your eyes feel first thing in the morning? If they say, oh, first thing in the morning, they're irritated, I'm reaching for eye drops, they're, they're red and I get crusts on the lids and lashes, that's my other question is, other than feeling dry and irritated, do you see, build up? Do you get that sleep on your lids and lashes? So really kind of throughout the day, knowing how the patient's eyes feel. But one of the again, other than that, other symptoms are burning, irritation. It could be at the base of the lashes, but sometimes patients can't really pinpoint where it feels. It just feels like itchy, irritated, the whole eye. Especially during this time of the year, patients will think it's allergies. So they'll think that they have allergies because, again, classic symptoms of allergies are itchy eyes and, irritated, maybe watery eyes. And blepharitis can present with similar symptoms. So anything that's eye related that you think that may be allergic, you should see an eye doctor, because then we can really determine, is it truly allergies? Because the treatment is different for allergies, allergic conjunctivitis versus blepharitis. And again, treatment is different from staph blepharitis versus, bacterial blepharitis versus mites, Demodex blepharitis. Or maybe the ocular surface is dry, maybe the tear breakup time is or tear volume is very thin, and the tears evaporate fast. And typically these patients will have symptoms more towards the end of the day. They'll say, oh, I'm on screens all day long, and in the morning my eyes feel fine, but then towards the end of the day they're feeling very irritated, or I can't wear my contact lenses anymore. So really, like I said, they're different causes. It's all like under this umbrella of ocular surface disease, but there are different root causes of it, and the treatment should be appropriately made for that condition.
Fantastic. And we've talked about causes of blepharitis and everything that falls underneath that umbrella, like you were saying. Is there a way, what I wanted to ask is there a way that we can avoid blepharitis? I know, like, we have different mites, that we have animals, we have bed sheets that have all these that type of things, but is there a way that someone can avoid blepharitis?
Absolutely. I use the analogy of oral hygiene. We have bacteria in our mouth, so we don't question it. We brush and floss our teeth twice a day at least, sometimes more. We don't wait for that bacteria to cause cavities or cause problems with our gum disease, cause gum disease and other things. So we have oral hygiene, and that's kind of what I use it's the analogy I use for my patients, that you gotta have you gotta have eyelid hygiene, because just like other parts, like in my mouth, we have bacteria. We don't want this bacteria to overpopulate and cause problems. So again, depending on the type of blepharitis, if they have something really aggressive or a more advanced version or advanced form of blepharitis, my treatment may be more aggressive and multiple times a day. But and then depending on, again, if Demodex are involved, that may have a different treatment protocol. Maybe in-office treatment, even we might do something in office. We would exfoliate the lids, and then have the patients use wipes or sprays and things like that afterwards. And I like to use wipes or foam wipes in more advanced, blepharitis. And then foam is when moderate to mild. And really for maintenance, patients, even if they have no blepharitis, I have them use a spray, a gentle spray. That's something that they can use, like a hypochlorous spray that they can use ongoing. And those, again, I'm not waiting for it to repopulate, because we know that this could be a chronic thing. So we don't want to just treat the patient and stop. We want to have them on maintenance treatment protocol, just like we have with our oral hygiene. So we have something we do every single day to keep the bacteria from overpopulating. And that's where I like the hypochlorous maintenance treatment.
Well, that's fantastic. And I like the analogy of like brushing your teeth too, because it goes back to what you were saying earlier about, keeping the patients in, about having that compliance. So that's an awesome metaphor there. So let's just say, for instance, like I'm a terrible patient, and just that I have inflamed eyelids. Like, and what happens if, for instance, it goes untreated, and I go, you know what, it's fine. I won't deal with it. If this goes untreated, can this contribute to other eye problems that some people have?
Absolutely. Well, chronic inflammation is not good, right? Acute inflammation is how our tissues repair something, our injury. But when we have chronic inflammation, that's where damage happens. And this damage could be happening to the lid margins where the meibomian glands live. And I show patients pictures, images, infrared images of their meibomian glands. And these glands are very important in the ocular surface and the health of the eyes. So chronic blepharitis can cause meibomian gland dysfunction, atrophy. And when these glands drop out, we can't bring them back. So something like that is very, it's important to communicate with the patient. And patients usually, when they say, oh, atrophy, I have glands that are disappearing, I better, do something about that. For women, when I talk about chronic blepharitis, I say that you could be losing your lashes over time. So that, I mean, for men, that could happen for men too, but obviously, but women may tend to be a little bit more concerned about that, that side effect. So, chronic blepharitis, yes. So your lashes could be falling out. And this is where makeup and things, like serum and false lashes and all these trends come into. Patients say, oh, my lashes start falling out, so I start using these products to help to grow them. Well, the lashes falling out because of this Demodex, because of chronic blepharitis. So treat the underlying cause, because other things that you're doing are just, masking the problem, but they're adding to the problem as well, right? So so those are the big, the big concerns. Obviously the ocular surface is, it's important to keep the cornea healthy. This is how we see the world. So if we have chronic inflammation on the lids, that causes dry eye, meibomian gland dysfunction, and causes corneal, it can cause corneal abnormalities, even like in worst cases, scarring. And obviously that's the where things could get scary for patient and vision, but with losing their vision. But patients do also, when I explain to them that dry eye is not just how your eyes feel or all these conditions, it's the fluctuation of vision. Patients will come in and they'll say, I think my prescription's changing because I feel like my vision is not good at the end of the day. But you take a look at them and it's really a tear film instability. Again, it could be caused from blepharitis, from meibomian gland dysfunction. And so when they actually see that, what I'm talking about, they see the changes in their vision, they may be a little bit more proactive and more compliant with the treatments.
Well, that is fantastic information. And I actually wanted to bring it up because you just talked about it a little bit about people who wear makeup and people who have these eyelashes who think they're going to help with everything, but really it's something different that's underlying. Are there people who are more prone to getting blepharitis? Like as you said, like people who wear this makeup who don't, do a great job of eyelid hygiene. Are there more people who are prone to getting this as opposed to other people, or is it just a blanket for every single person?
Well, everybody's at risk of having blepharitis, right? But certain practices can definitely exacerbate the problem or cause more severe form of blepharitis, right? For example, a common thing, or it's really popular now, or has been really, the false lashes, fake eyelashes that women have glued on their natural lashes. So they have these long lashes that are difficult to keep clean. So that the gap between where the false lash is applied and where the base of the lashes, that is the area where I see a lot of buildup, a lot of blepharitis, because it's very difficult to keep that clean. So even if they say, oh, I clean my lashes really well, I see problems because it's just such a easy environment for bacteria to overpopulate. So that would out of the cosmetic practices, I would say that's the highest. Other things like using lash serums, for elongation or lash growth, that tends to cause more inflammation. Again, patients, if they use those and then also on top of that don't remove their makeup really well, I see a lot of problems with blepharitis in those cases, in those patients. So in general, I don't recommend having false lashes, maybe once in a while for a special event, and then just not like every single day wear, because these also have to be replaced every 2-3 weeks or so. And when they redo them, they apply glue, which is very toxic for the ocular surface. So then you're just like adding fuel to the fire. You're just really inflaming the eye, the ocular surface even more.
Fantastic. And before we wrap it up today, Doctor, was there anything else that you'd like to let our audience know about before we go?
Well, we know that dry eye is a growing problem, right? And I think this is something that I'm sure your audience would agree with me. This is something that we need to really take seriously, because it's been estimated that over 50 million people suffer from symptoms of dry eye, but not all of them are diagnosed properly. A very small percentage are diagnosed and smaller percentage are actually treated. So this is a problem that we should be really looking for. Even if the patient doesn't present because they think it's normal or it's allergies, we should be looking for ocular surface disease, for blepharitis, for dry eye, meibomian gland dysfunction, and really offering treatments that are the patients can understand and be compliant with. So that's my message to everyone, to really, it's a growing problem, and we really should be screening and looking for this, even if the patients are not complaining of it.
That is definitely excellent advice. Everyone, that was Dr. Mila Ioussifova. Dr. Ioussifova, thank you so much for joining us today.
Thank you so much for having me.